We are honored to introduce our keynote speaker who will be explaining how Bahrain is responding to COVID-19, the Chief Executive of the Information and eGovernment Authority of the Kingdom of Bahrain, His Excellency Mr. Mohammed Ali AlQaed.
I would like to start with thanking BIBF for this opportunity to speak at this virtual forum, achieving excellence in the pandemic or during the pandemic. I think to start with, we must, I would like to emphasize on the wise vision of His Majesty the King Hamad bin Isa Al Khalifa and the proactive measures taken by the National Committee combating the coronavirus COVID-19, led by His Royal Highness Crown Prince Salman bin Hamad Al Khalifa, Deputy Prime Minister, Deputy Supreme Commander, and First Deputy Prime Minister. Of course, the excellence achieved by the government of Bahrain, it was due to many factors and many things. To start with is the decision making and the process dealing with the pandemic, having the high level committees, two high-level committees, executive committee led by His Royal Highness, and another one, technical committee, with the membership of all stakeholders. That is very important to achieve what we achieved so far. Of course, taking the informed decisions based on facts, researches, alliances, talking to friends, and dealing with the media in a centralized manner, with the clear responsibility about who's talking about what and who's responsible about what information going out, with a very transparent way. And of course, the technology played a major role, and it's a very important role in combating the virus or dealing with its impact. Bahrain government, as we know, continued operating during the pandemic. And if I may ask the presentation, if you can please share it with the screen. So the Bahrain government continued operating without any lockdown. Many governments had a chaos or stopped working for weeks or months. In Bahrain, I think we took all the measures required to continue operating with minimizing the risk factors. The decision was to work 50 to 70% of government employees working from home, alternating every 2 weeks. And what we did at IGA, that we immediately issued the guidelines and being proactive to support the government, supporting and allowing tens of thousands of government employees working from home. Start sharing. I think if the organizer cannot do it, I'll do it from my side. So as we know, the enabling work from distance required a lot of effort to give enabling the government employees working from home, as I said, giving access to government network through secured VPN. Tens of thousands of government employees worked from home using the normal setup, and thousands of them required the VPN support virtually and having encrypted access to their systems if any sensitive systems required access. Of course, all of that happened. We didn't had like a drill or a test or planning without a long time of planning. Decision was made in a week time. Everybody were ready to work from home without any kind of interruption. All of that happened, as I said, in a week time. Some network upgrades required and bandwidth upgrades, enabling all government employees meeting through Microsoft Teams or Zoom, or very few of them maybe using a WebEx, Cisco WebEx. We have platforms, the cabinet, the ministerial committees, executive committees, forums, international meeting with the international license. All of that required a huge setup. And the good thing that Bahrain government were ready. We were ready with the Bahrain government with the clear guidelines who can use Microsoft Teams or how to use the Zoom. For each one, the guidelines were ready and the setup was there with the proper bandwidth required. The other thing, of course, the education. Very important that we managed to continue educating and with education system. Some pressure and some issues was there with the education, EduNet, Ministry of Education, having a lot of pressure on the systems because it never gone or went into that kind of high demand. The good thing again, because of the experience, because of the cloud first policy, because of the skill sets that we had in a quite a very long time, we managed to migrate all of that to the cloud in a week time, relieving a lot of pressure from those systems, and then using virtual classrooms, using Microsoft Teams with some tweaks according to the agreements with Microsoft. So all of that showed the power of the cloud and the wise decision that was made by the government of Bahrain at a very early stage, using being ready with the infrastructure. Of course, all of these achievements didn't happen overnight. All due to the proper governance that we had a long time ago, the infrastructure, very solid infrastructure, the network, having a centralized network with the fiber access, the agreements and enterprise agreements with the telcos to provide the proper infrastructure supporting the government, the government data network, the data centers on-prem or the cloud, be it AWS or Microsoft or any other clouds. We have enterprise agreements with most of the cloud service providers. The availability of system monitoring, the ensuring the availability and system monitoring to make sure that if anything goes wrong, we have the tools to monitor and to take the actions. Enterprise agreements with Microsoft, with AWS, with Cisco, Oracle, IBM, internet providers, telco providers, managing the government cloud services and having the right tools and the skill sets, reviewing and approving IT procurement projects and recruitment, and making sure that the entire government going into the right direction. So a lot of work. It's due to the fact that the government of Bahrain well established and the infrastructures in terms of service, in terms of readiness to be ready for this real test with this pandemic. The policies and standards were in place, so whenever we had like a gap or something to be complemented, for example, for the video conferencing or the working from home, already we had something in place before. We had the setup before. We had the VPN setup. So we just had to extend this to all the government. Although the pressure of enabling or configuring tens of thousands of employees to work from home, maybe it required a little bit of effort, but because of the foundation was there, we managed to cope with all of that. And of course, I think one of the key reasons for the successful implementation, the cloud first policy, and going with the cloud at a very early stage before many governments worldwide, because I think in this pandemic, very few governments could cope with the demand and with the pressure on their networks and systems if they didn't had this choice. And I can talk a little bit more about it when we talk about the system supporting the pandemic and combating the pandemic, like the Be Aware app and the associated systems. So I said the foundation was available, just a few upgrades required. The other thing is the well-established e-government services. As we know, the transformation of the public service delivery, the re-engineering of the public service, having more than 60% of the government services already online, more than 400 e-services provided through Bahrain.bh, or the mobile channel or kiosks or contact center, introducing more services during the pandemic. As we know, since the launch of the e-government program in 2007 by His Highness Sheikh Mohammed bin Mubarak, the Deputy Prime Minister, the Chair of the Supreme Council for ICT, Bahrain ranked amongst the top countries worldwide in the consecutive reports since the 2010, since the end of the first implementation of the first strategy. So since we launched the e-government strategy, first e-government in 2007, and completing the implementation of that first strategy, Bahrain always ranked top worldwide. As I mentioned, with the number of services, with the maturity, with the uptake, very high uptake, that we reached to many services up to 100% or close to 100%, 90% or 80% for many services. The awareness in the past 8-9 years was always above 90% of our customers. The satisfaction always is above 80%. Government entities shifted to online services a long time ago, and the visit is a need to during the pandemic, when it required to have a real test on those systems and electronic services, the government decided to reduce the number of the government employees working and reduce the interaction with the customers. What we did, we introduced additional 45 services, very critical services, making sure that we don't affect the government services. Without any intervention, I think in a week time, introducing a 45 additional services that required a lot of effort, but because again, the readiness that we had before, we managed to do so. And one of the major services that transformed, as we know, is the court systems, allowing the judicial system to work effectively without the interaction. And I think many of those courts maybe had some resistance from lawyers or from judges before. The pandemic was a good opportunity to transform those services. Again, what we did, we tried to offer many other services in alternate ways. So if we couldn't introduce some of the services or transform or deliver them in a short period of time that required maybe weeks or months, We offer those services via alternative channels, like a call center or email, so the employees can continue supporting the customers without the interaction and minimizing the interaction. And to minimize the risk, instead of a total shutdown or lockdown, appointment system was introduced, less operating hours, following a social distancing, wearing masks, hand sanitizing, and so on. So what was happened, for example, with the ID card and all the services associated, what we managed to do to reduce the number of appointments by 70–80%, while we offered more services than during the pandemic than the services offered during the normal days, because of the efficiencies, higher efficiency, providing those services electronically or through alternative channels. So again, because of the solid team and infrastructure, having backend systems and electronic services with the channels in a centralized way, with all government entities, Government of Bahrain could deliver the services, continue operating without any impact. In many cases, it was much more efficient and effective, providing a better service. Of course, the governance that we had in place, the legislations, the skill sets and training, having a very high uptake with the customers already using and engaging the elder women employees, visitors, as well as the all the everybody in the society to the services. I think that again was one of the major reasons for the successful implementation of those services. Lastly, I will just talk about what we did to directly combat or deal with the pandemic in terms of the technology supporting the national team. We started, as we know, Bahrain, Be Aware Bahrain mobile app as a national mobile app to support the National Committee. We started with the app, and then we started developing entire system that supports all the stakeholders, supporting the app as well as supporting the stakeholders. So the Be Aware app is not just to provide a national platform to provide the information. Instructions are there, information, statistics. We have services, taking appointments, getting the results, giving alerts, contact tracing alerts, booking appointments, exit swap appointments, as well as controlling the home quarantine. And lately, a few weeks back, when the National Committee decided to practice the home isolation for some cases, again, we use the same app to support all of those. So, as I said, we have the tracking interaction with the infected cases, sending alerts, completing and controlling and monitoring the cycle. We have the systems supporting Ministry of Health at the airport, at the during the taking the swab, registration of the people for the home quarantine, for the doctors, nurses, the admin team, call center having some partial view to support the customers and the operations room, following up for the cases of the home quarantine. So all of that is fully controlled systematically with a minimum intervention, and to make sure that we save lives, we give the timely alerts for the people to protect themselves, their beloved ones, their families, If somebody is in a contact with any case, he will be notified at very early stage. When we started, and maybe at the beginning, nobody imagined that the number of cases would escalate to this level. With the technology available, we managed to properly deal with those cases because of the automated alerts going out and automated control and monitoring of all of the cases. So just going to over some statistics, the downloads is almost 800,000. Registration is half of that number, about 410,000. Under home quarantine, currently we have 12,000. And the last number is the under home isolation. We have about 2,000 positive cases under home isolation. To do that and to be very efficient, we use the volunteers everywhere and the contact tracing. The alerts was sent to 12,000 suspected cases. About not all of them, in the slide you can see that all of them tested is around 9,000. We have tested suspects with the results out. 9,000 tested with the results out. 1,600 to 1,700 found positive out of these, with a percentage of more than 15%. Sometimes we reach to 20%. That's a very, very accurate and very, very high number of run rate because of the big data and because of the automated way and the way that we deal with the contact tracing data. Of course, we keep those data for the AI in an automated manner. We don't give the voluntary for the contact tracing, which is voluntary. We don't give that data or access to that data to any government officials. It's just run by the machines with the results. And then we use, of course, the bracelets. We have more than 3,600 active bracelets currently, with maybe more than 30,000 available, and we are ready to be used for home isolation and home quarantine for if the numbers escalated. I think we are ready to deal with those. So that took a lot of pressure from the national committee, from the health staff, to focus into more serious cases, allowing them to save more lives and work in more concentrated manner. Those are some screens when somebody gets a message that they are suspect, and then when they go into home isolation, at the middle we can see how many days is already passed and how many days left. What we learned, I think, from this pandemic, it was a real test to our systems, to our readiness. Nobody expected this kind of pandemic coming, or this kind of crisis that could affect the entire globe. But I think in Bahrain, we were ready with the way that we dealt with. So the lessons learned that always when you invest in technology, it will pay off. And to infrastructure, having the proper infrastructure, proper policies and governance, then you can deal with it in a proper manner. It's very important that we have more virtual meetings in the future, even post the pandemic, more virtual events, conferences, not to save only time, but and effort, but to be more efficient, to extend our network, learn more, because that saving that time will allow us to attend more events, to learn more from other experiences, having a higher exposure, and to be ready. As we know, many governments, when they try to provide education, for example, they couldn't cope with the traffic. So if you have some classrooms, if you have consultation for the doctors, then the entire system and entire government is ready for anything when it happens in the future. The other thing is the importance of AI and big data. As we know, with the tests and random tests, the positive cases found only on maybe 0.2%, and max maybe it's reaching to 1% of the efficiency. So that escalates the cost, shooting very high for the test, because you test 1,000 to get maybe 20. With the big data and AI that we use in our application, we managed to reach a 15, 17, 20%. It's very efficient, saving time and money. And that's the power of the big data and AI. We have to invest more into the skill sets, into the technologies, and having maybe inventions around those. Another one is the cloud, importance of a cloud. Without the cloud, we couldn't run the queries to provide the contact tracing. It's a massive data with all the movements of people, and comparing that movement of one person with 1 million or 400,000. It's a massive data. Without being on the cloud, without having the proper infrastructure and setup and security around the cloud, I don't think we could achieve what we achieved here. And we have to be a smart government and stop visiting the government centers. And I think that's the new challenge, that we have to reduce the number of visits to the government entities. By that, I will conclude my speech, and thank you very much for this opportunity.